on the left, and then we'll turn it on. Okay, lovely. Okay, now, I've had some students, I did this for the first time, shine the
Backwards?
light in my own light. Okay, now, the side that has the label Welch Allen is the one you look through. Okay, now, the diopter is what's gonna change the focus.
I think that's the
And
dial.
that is a dial that is moved by the thumb like this. Now you notice that it has green numbers and red numbers. Well, what happens is that when you start at the 6, you normally start at the green 6. So for instance, if I'm doing the right-sided exam, I've got to move my thumb up to go from the 6, which is a number I use to visualize the red reflex. But to bring the retina towards me, that's a closer focus, I'm going to have to move my thumb up, going from a 6 to a smaller number. The number that you choose is based on wherever the focus fits between your eye and the patient's
So to
eye.
bring it closer, are you actually doing it clockwise?
See, what you're doing here is that this is actually moving counterclockwise with the right eye.
To bring it,
Down. Now, you notice that if I start at 6 for the left eye, holding this in my left hand, to bring the number down, I'm moving counterclockwise again. So this is, oh. So that would be clockwise,
Clockwise.
and this would be
opposite would be
counterclockwise, right?
Okay.
Okay, now the other thing to do is we can change the size of the field, and we can change the color. See, that's, so we want, the slit is sometimes used to look at the cornea under Wood's light, to look for any corneal abrasions. This, do you see the measurement? We use that to measure, for instance, a hemorrhage, how many diopters it is away from the cup and the disc. The diopter will be one of those little gradations. So those little ticks are the diopters. So if something's like 2 ticks out, it's 2 diopters away from our central measurement, okay? Now I normally start out with this when I actually look into the retina, but that's going to happen a little bit later. Alright, so I'm just going to leave that there. Okay, so now the eyebrows are fully distributed. The eyelashes are as well. There's no ectropion or entropion. Now I'm going to check the lacrimal. Now is there any tenderness here?
Nope.
Okay, great. Now I'd like you to look up. Now the palpebral conjunctiva is pinkish red. The bulbar conjunctiva is clear. There's no injection. So basically I'm saying the sclera looks white. That's what I've just said. Okay, now I'm actually ready to do all my eye tests, and then I can do my retinal exam and my pupillary exam. So, the one that I love I always start out with. Now if you look up at the light, now the corneal reflex is parallel, and it's at 12 o'clock. Does everybody see that? Now it's going to look different, but the 2 corneal reflexes are at the same place. Now we're going to do the cover test as if he had a problem. Okay, Warren, do me a favor. Put this over your right eye, and I'd like you to look at my finger and uncover the right eye so there's no movement of the right eye. So he has no phoria and no tropia. Now we're going to do extraocular eye movements. So I'll do the H for you. Now if you'll follow my finger, okay, 3 superior, 3 inferior, 3 medial, 6 lateral. Now, 3 superior, 3 inferior, medial, 6 lateral. Hard not to move your head. Now, cranial nerve 4. Now the eyes are converging. The pupils are getting smaller. So he is positive for convergence, accommodation, and cranial nerve 4 is intact. Now if we do it the more sophisticated way, you should be able to tell me what you're doing. Okay, so I want you to tell me if you have any trouble following my finger, but I don't think you will. So, Okay, now that's 3 superior on both sides. Okay, that's left 6, right 6. Okay, now that's 3 inferior, and then 4. Cardinal visions, right? Okay, so you can do it either way, but you have to be able to tell me what nerve is moving in which direction. Fair enough? All right, now let's do the peripheral fields. Now, if you could please cover up your left eye. Now, what I'd like you to do is to keep on looking at this eye and try not to look at my finger. Just let me know when you see my moving fingers.
No.
That's 50.
No.
60.
No.
70.
No.
90. So the visual fields by confrontation are all normal. 50, 60, 70, and 90. Very nice. Okay, now we're ready for some pupillary reflexes. Now, first of all, I'm going to inspect the cornea because I've got the light. Now I'm just going to lift this, and as I look through, the cornea is transparent over the iris, so I don't see any abrasions. Now, coming in from the periphery, okay, the direct light reflex is intact, and so is the consensual on the other side. Now, coming in this way, okay, the left reflex is intact, and consensual works as well. Well, that's very interesting. You have a little of anisocoria, you know that?
And that's Korea.
Yeah. This pupil doesn't ratchet down quite as much as the
No.
other.
They're only equal size.
They're a little
not equal.
uneven. That's great. 1 out of 10 people has anisocoria. But you do have consensual reflex. It's just that the right doesn't ratchet down as much. That's neat. I
I'm a
like
good
that.
candidate.
Very original. Okay, now, since he's kind of up on the throne, I'm going to have to kind of help him so I can see him. So what I'm going to do is ask him to just look down a little bit about, we'll probably have you look right there. Now for this one, I'm going to prepare, I'm going to think through this. Now I've got the instrument in my right hand, I'm going to put this at 6, and I review, okay, in order to get to a smaller number, closer focus, I've got to move my finger up counterclockwise. Now, could you dim the lights? Just turn them out, and we'll use the backlighting there. Thanks. Now, take these wonderful things off. Okay. Now I'm going to come in at a 15-degree angle. I see the red reflex. Okay. Now, oh, what fun! Oh yeah. Now, do you see how I'm going to the different angles? Okay, I'm done. All right. Now, his cup to disc ratio is 1 to 2. He has a light background, a pinkish background, whitish pink. The arteries are definitely red, and the vein ratio, artery to vein ratio is 2 to 3, and the veins are a darker blue. Nice job, Margaret. Now, this side. Now again, first of all, I'm going to get to my 6. Now this time I'm going to have to move the diopter down, get to a smaller number. So now notice that I take my opposite hand and I hold the eyelid up, bringing this to my eye. I see the red reflex, and now I'm going to focus. Okay, same sort of thing. Pretty neat. Okay, that's all there is to it. Do you know what your big challenge is going to be? It's not any of the exams, it's really this. It's the focus. So that's what you need to practice now. Okay?